Welcome to Medically Speaking. Our guest today is Sheila Goerss. As you can see, we are practicing safe social distancing. Sheila's at home. I'm at the Coles Library on East Elvin in Buffalo, where our VNA labs have opened their new COVID-19 testing site. Sheila, thanks for joining us today.
Thank you.
Tell us a little about what you do. You work at Suburban Hospital, and tell us how long you've been there and what you do.
It'll be a year in May, and I work in environmental services.
And so for those who are watching, or those who are not in healthcare, what does environmental services do in a hospital setting?
We are responsible for keeping the hospital clean.
And in terms of whether it's COVID-19 or not, cleanliness in a healthcare facility is vitally important. Why is that?
Keep the germs down. You don't want people, constantly being sick, and you don't want to get sick. So it's vitally important.
So let's talk a little bit more about that. There's been obviously a lot of awareness around cleanliness, washing your hands, things like that, personal protective equipment. But that's something that you guys do for a living. So in your daily routine, what does your daily routine look like?
Well, my responsibility is 2 north, so I have my own floor. And then after that, that's when the discharges start coming in. So I'll go ahead and do discharges, which is cleaning the room from top to bottom. And now with the COVID-19, our time is doubled. So we're in the room twice as long because you're bleaching and then Virexing everything. And like I said, you just want to make sure everything's clean. So the next person comes in, you feel good that they're laying in that bed.
Right. So if you think about the team aspect, there's obviously the front line has been very focused on during this pandemic. Mm-hmm. So the nurses, doctors, but there's a team aspect to healthcare. There's a team aspect to the hospital system. That's dietary, that's EVS, transport. Tell us what the team aspect means to you as you go through this.
I think everybody has the same mindset as far as we want this all to be over with, bottom line. You know what I mean? And I think everyone's in it to make sure that what they're doing is right, as far as cleanliness. I myself I'm a clean freak anyway, so I make sure that when I wipe down everything on that floor. But everyone's just chipping in, and I'm training someone this week because she's part of the COVID response team. So I think everyone as a team is chipping in and making sure that we're doing everything we can to keep it sanitary.
Sure. So as you think about your role, and like you say, you're cleaning from top to bottom, if you had a message for people who are watching, or if you had a message for people who may be afraid, there's been talk that people are afraid to come to the hospital, whether it's to the emergency department or for a clinic visit, because they're afraid they're going to get COVID-19. But in reality, for the work that you guys are doing, the protocols are in place in terms of screening and universal masking. Isn't the hospital a safer place right now?
I think the hospitals are cleaner now than they ever have been, honestly, because everything's wiped, every touch point, every doorknob, every rail, every faucet, everything is wiped down more than once a day. So it's a constant rotation of wiping. So I would say it's cleaner now than they ever have been, honestly.
I can sense pride when you talk about work and about Suburban Hospital and your coworkers. Are you proud to tell people, especially in the middle of all this, what you do for a living and where you work?
Oh, absolutely. Now, my husband and I just had a little disagreement. He feels everything should be open. And I said, do me a favor, go to the ICU, look around. You have a second thought. It's sad. So I feel good when I go in and do my job, because I know when I leave, I've done my best.
And as part of that, when you say you've done your job, you've done your best, part of what you're doing is you're keeping the nurses, the physicians, and the patients safe because you're keeping the facility clean. So there's a sense of accomplishment, you know, when you come into work and when you leave. Why is that important to you?
Well, I look at it this way. If it was my mother in a hospital bed, that room's going to be cleaned like my mom's going to be in there. And that's how I feel about every room I do. So I go above and beyond because I want to know that if that's my loved one, they're going to be safe in that room.
Right. So Sheila, as we're wrapping up, you've seen the community outpouring of support for those in healthcare, for hospital workers. Do you have a message to the community in terms of how it's made you feel?
Well, it's been crazy, the amount of food being sent into the hospitals. I'm going to have to literally join a gym because there's so much being donated. Like, I think it's like 3 or 4 times a week. There's sweets and lunch. It's crazy. But honestly, I'd like to say thank you to everybody because it's been amazing. It makes you feel good.
Well, on behalf of a grateful organization, Collide Health, and a grateful community, thank you for what you do every day. Thank you for battling on the front lines of this pandemic. We appreciate you, and thanks for joining us today.
Thank you.